And we're talking about the cost of care. About 48 million Americans are caring for someone over the age of 18, with many of them caring for an aging parent or relative. And the value of that unpaid care is around $600 billion a year, according to AARP. Sharon Epperson with me now with more on that. Sharon?
Well, you know, this is troubling to a lot of caregivers because out-of-pocket costs for health-related and long-term care expenses are often far greater than expected. I met 3 siblings who are taking care of their mom at home, and we talked about the emotional and the financial strain of being family caregivers. After Ernestine Taylor had a stroke 4 years ago, her daughter stepped in to take care of her.
They're so good to me.
Daphne, a retired project manager and oldest sister, took the lead.
It was all a learning process.
Along with sisters Sheila and Debbie, who are also retired, the 3 worked together to provide their 87-year-old mom around-the-clock care, creating spreadsheets, managing medications, tracking her progress, and navigating expenses.
We've been up and down, around and about, buying things that someone would suggest that you use this can help do this, so thousands of dollars.
They've paid out of pocket for medical equipment, transportation, and supplies, not covered by Medicare or insurance, including a $5,000 hospital bed. Nursing home care costs over $100,000 a year. A home health aide, $60,000. And when a family member provides the care, the average spending on caregiving activities is more than a quarter of their annual income. In the last year, if you could think of what financial sacrifice might you have made? I'm sorry.
It's been hard. It's so complicated. When you start trying to figure out even just in what we what she might be entitled to. We can just pay off our bills and stay afloat. That's a good thing, and that's what we're trying to do.
Financial advisor Barry Glassman says planning ahead for long-term care can reduce some of the financial strain, but he understands few families actually do it.
It's tough because a person in their 80s doesn't really know when they may need help or what help they may need, if at all.
Family caregivers can get paid through some state Medicaid plans. They may also receive assistance if a loved one is a veteran. But you have to apply for these programs.
We're trying to take care of our mom 24/7. There's just no way in the world that you have time to try and figure this all out.
Piecing together finances for their mom's care has been overwhelming. But these sisters say family and faith offer the support they need on the most trying days. Now, experts say it's important for family members to talk about the what-ifs and discuss who will make health care and financial decisions if an elderly parent is unable to make those decisions themselves. Knowing who will take on those responsibilities can help alleviate at least some of the stress, John.
Sharon, this is so important because it affects just about everybody. It seems in a way like elder care is the new college, right?
Absolutely.
It's this cost that maybe there's some assistance for it. Maybe people can plan and save for it, but maybe they can't. It affects retirement and your ability to pay for things. What about the people who aren't wealthy, who can't easily afford this, the people in the middle? What are the steps they can take?
Well, it is something that is a multi-generational problem that people are trying to figure out. And so trying to find that financial assistance can be difficult. There are state Medicaid programs that can help. If you're a veteran, there are programs that can help. There are also some neighborhood programs, community service programs that may be able to provide some assistance, maybe some respite care, so a family caregiver can have a break. But it really takes time. It takes time to find what you can get assistance with, and finding the tax breaks that you may qualify for, whether that is through your employer, through a health savings account or flexible spending account, or even if you're able to declare that parent as a dependent and take a medical expenses deduction or a dependent care credit. So there are ways to find that, but you got to piece it all together, and that kind of patchwork effect is something that can just be so overwhelming.
Well, we're a country with an aging population, fewer young people coming in.
Yep.
Maybe we need a 529 for elder care.
Absolutely. 2034, there will be more people over the age of 65 than there are under 18. So we need to address this.
Thanks for sounding the alarm. Our
Sure.
Sharon Epperson.